Hi everyone, welcome back to my YouTube channel. Hope you all are doing well. It's a special day for me. You must be wondering why. Today I will be sharing information with you in the form of a podcast. Let's jump right into it. On December 7th of 2021, CMS had a press release on US Department of Health and Human Services announcement on efforts to help expand nationwide access and coverage for high-quality maternal health services. As part of Vice President Kamala Harris's call to action to reduce maternal mortality and morbidity, the U.S. Department of Health and Human Services, or HHS, through the Centers for Medicare and Medicaid Services, or CMS, is taking steps to improve maternal health and support the delivery of equitable, high-quality care for pregnancy and postpartum care. CMS intends to propose a birthing-friendly designation to drive improvements in perinatal health outcomes and maternal health equity. The designation would initially identify hospitals that provide perinatal care, are participating in a maternity care quality improvement collaborative, and have implemented recommended patient safety practices. In addition, CMS is encouraging states to take advantage of the American Rescue Plans or ARP's option to provide 12 months postpartum coverage to pregnant individuals who are enrolled in Medicaid or the Children's Health Insurance Program or CHIP. This follows the release of a report by U.S. Department of Health and Human Services Office of the Assistant Secretary for Planning and Evaluation showing the dramatic impact if states extended Medicaid postpartum coverage to 12 months. If every state adopted an extension as proposed in the Build Back Better Act, then the number of Americans getting coverage for a full year postpartum would roughly double, extending coverage for an estimated 720,000 in a given year. Medicaid and CHIP, or Children's Health Insurance Program, cover over 42% of births in the nation, nearly half of which are to Black, Hispanic, or American Indian/Alaskan Native individuals. Extending the postpartum coverage period can improve health outcomes during the postpartum period and mitigate health disparities for individuals served by Medicaid and CHIP. U.S. Department of Health and Human Services Secretary Javier Becerra said, quote, "As a father to 3 daughters and husband to a high-risk obstetrician, I know nothing is more important as having healthy childbirth." He also said, quote, "I'm proud that the Biden-Harris administration has made maternal health and equity a priority. We will continue to take actions to support new parents and ensure safe pregnancies, no matter a family's background." CMS Administrator Chiquita Brooks-LaSure said, quote, "No mother should have to fight for her coverage or care during pregnancy or while caring for a newborn. CMS is doing everything we can to support the health of new parents and families and to advance health equity across the country." Chiquita Brooks-LaSure also said, quote, "Across the Biden-Harris administration, we are committed to advancing equitable, high-quality maternity care and reducing unnecessary postpartum illnesses and deaths that disproportionately harm people of color." Beginning with discharges on October 1st of 2021, CMS adopted a new structural quality measure for the hospital inpatient quality reporting program that asks hospitals to attest to whether they participate in a statewide and/or National Maternal Safety Quality Collaborative and whether they have implemented the recommended patient safety practices or bundles to improve maternal outcomes. Through this measure and others, CMS intends to propose a hospital could be considered birthing friendly with special designation on CMS Care Compare website. Maintaining Medicaid and CHIP coverage for an extended period of time can help address persistent disparities that exist in pregnancy-related morbidity and mortality. 1/3 of maternal deaths occur between 1 week to a year after childbirth, and rates are especially high among Black women and American Indian/Alaska Native individuals. Expanded coverage helps to ensure access to the ongoing care people need during the postpartum period. It will also help individuals in the postpartum period manage chronic conditions like hypertension and diabetes and provide access to behavioral health services. Currently, Medicaid beneficiaries are entitled to continuous coverage through the end of the month in which their 60-day postpartum period ends. In states that adopt the new extended postpartum coverage option, individuals who are enrolled in Medicaid or CHIP while pregnant will be eligible for 12 months of extended postpartum coverage. Additional individuals who will benefit from a state's election are those whose pregnancy ended within 3 months of their application for Medicaid and who would have been eligible when their pregnancy ended had they applied earlier. The state health official letter includes guidance and resources for states that take up the state plan option to ensure that the extended coverage leads to improved health outcomes for postpartum individuals. CMS is available to provide technical assistance to states as they extend postpartum coverage, implement innovative payment and delivery system efforts, and engage in initiatives to measure and improve quality aimed at addressing the needs of pregnant and postpartum beneficiaries. States that elect to provide the extended postpartum coverage option are encouraged to educate beneficiaries about the availability of extended postpartum coverage. For more information about the maternal morbidity structural measure, I have pasted a link on the slide as well as in the description box below. Hope you enjoyed this podcast today. If you found this information helpful, please consider subscribing to my channel and leave me a few comments. Thank you for listening. Hope to see you next time. Bye now.